Morning and welcome to the June 9th Board of Commissioners meeting. We'll call the meeting to order. It's 9 o'clock. Roll call would indicate all 5 commissioners are present. Please rise for a moment of silence and followed by the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. First item is approval of the agenda. Mike, any additions, corrections? Okay. You looking for a motion to approve the agenda?
So moved. Second.
Thank you, Commissioner Bertram and Commissioner Johnson. Any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Next item is a presentation and awards. Randy?
Yep. So today we have an award recipient, Roxanne Garrett. If she would come up. So Roxanne Garrett has won the Minnesota Excellence in Elections Award. It is given by the Minnesota Secretary of State, and it honors election workers for their outstanding service to the state of Minnesota. The award was created in 2025, so a very new award. And it's voted on by, so they take nominations and it's voted on by the peers, and she was one of the ones selected for that. Roxanne's been with the county for 27 years and the election supervisor for 7, so I'll turn it over to Laura to make some more comments.
Good morning.
Awesome. Good morning, Mr. Chair, Commissioners. Just an overview of the recognition that Roxanne received. She received this award at our conference for election certification by the Secretary of State, Steve Simon, for delivering smooth, accurate, and efficient elections through nearly 3 decades of change and growth and continuous law changes. Elections are all about following Minnesota statutes and processes. She has a strong attention to detail that has contributed to flawless compliance with state and federal requirements. She's dedicated to supporting our local jurisdictions and in every step administering elections, from notices, the clerk trainings, head judge trainings that are in person. We also train over 1,000 election judges online. She helps with election day duties, managing the equipment, recounts, certifying election results, and the list goes on and on. With her leadership, she has well-trained staff, which we are proud that they are with us today. Our election specialists, so we have Nikki Lahr, Mary Kay Lindmar, Jess Lehner, and Julie Ritz with us, are a central part of her success and the success of the election administration in Stearns County. With that, we have the award to present today. On behalf of the state of Minnesota and Stearns County, I'm very proud to be a part of your team, Roxanne.
Congratulations. Speech.
I'm very grateful and humbled for this recognition. And I couldn't do it without our team. Thank you.
Yeah. Thank you, Roxanne. Greatly appreciated what you guys do for the county and much deserving of the award. Thank you.
Thank you.
I think we're going to do
Gonna
some
get a picture,
pictures.
too.
Yeah.
I'm gonna put some, since we want to come on this side, I want Roxanne in the middle if I could, or maybe go between Joe and Steve. So squeeze in a little bit. There, a little more even. Okay. Take a few, so keep smiling. Okay.
Nice.
Thank you. Sorry.
Yeah, we're good. You didn't want to trip you. Thank you.
Okay. Next up, we have the consent agenda items. We have a list today of 23 consent agenda items. Anybody have any they wish to pull or comment on?
Mr. Chairman, I
Mr.
request F-15 be pulled.
Okay. F-15. Any other ones?
Mr. Chair, I'll pull F-20.
F-20. Okay. And Commissioner,
Approval of the remaining items, so the consent agenda, with the exceptions of F-15.
Second.
okay, thank you, Commissioner Johnson. Any further comments or discussion? I was just going to make a comment on F-16 with the sheriff vehicles. Hopefully nobody got hurt too seriously. It seems like there was, what, a rollover and a accident with the pickup, but,
One person injured, I think, so, but
okay. All right, thank you. Any other comments? Seeing none, all those in favor of the consent agenda with the exception of 15 and 20 signify by saying aye.
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 Opposed? Motion carried. All right, so do you want to comment on F-15?
Sure. It's the appointment to the Airport Commission. I've got nothing against Mr. Blenigan, but I went to the last meeting of the Airport Commission because I saw on their agenda that they were going to go into a closed session for discussion on the white paper, which is basically the cap that I thought all five parties kind of agreed to. In asking several people, they said it really wasn't an item that should have been allowed to go into a closed session. And my fear is that if we don't send a signal to the Airport Commission somehow, and again, I know how this is going to go, but I'm going to make the point, they just are continuing to do what they want to do. I told the chair, Mr. Myers, I said, if five of us are buying a cabin together, and one of the five says, well, I'm going to step out in the hallway and have a discussion with my attorney, the rest of us are going to look and see, well, are we buying this together, or why are you consulting an attorney when all five of us are going to be doing this? So when it came to that point of the meeting, we all had to stand up, including a reporter who strenuously objected to it, and we had to leave the room. So they had the discussion. So is Mr. Blenigan directly a part of that? Well, he's on the board. So the board continues to be unanimous decisions. There isn't a lot of discussion or anything on this. And again, this is a free-for-all. It's $1 million this year. It could be $10 million next year, and we have no control of it. So I guess for that reason, I would move that we do not reappoint Mr. Blenigan to the Airport Commission.
Commissioner Clark,
Yeah, Mr. Chair.
turn your microphone on, please.
Thank you. Thank you, Mr. Chair. I have strong feelings, too, about that meeting having been closed. My understanding is they were given a legal opinion that they could close it. I'm very surprised about that because it seems like it's a clear violation of the open meeting law. I think sending a message continues to be a good thing. I think, though, that we should reappoint him perhaps, but perhaps we table it for a month and we come back to it, because they do need to get some business done. He's done a great service for our county, but I do think I don't know if you'd be open to amending that, Commissioner Bertram.
I'll second that motion, first of all, so we can have a discussion on it, and then we can either kill it or move it or whatever, all right?
Okay.
Mr. Chairman, I would be open to accepting the amendment to the motion that we table it for, I guess the clean thing would be to rescind the motion and
Yeah.
make a motion to
Yep.
table it. So if that's the cleaner way to do it, I'll make that motion.
Okay.
Well, actually, I think Commissioner Clark made the motion. I'll second that.
I will make that motion.
Okay, we have a motion and a second to table the appointment of Mr. Blenigan to the Airport Commission, which is item F-15 on our consent agenda. Further discussion?
You want discussion on tabling?
Well, I guess we can't. We just have
If you
to-
do, I do have some comments, but it's up to you.
Well, being we have a table, we'll table it for a future date.
Okay, thanks.
Okay,
Mr. Chairman, just though, maybe for some folks to reflect on what Commissioner Johnson has to say, it might be valuable for the airport and us to know that, so I don't know when the right time would be, but I think it would be appropriate.
okay, well, yeah, if everybody is amenable to it, Commissioner Johnson?
Thank you. I've met with Mr. Blonigan. I've talked with him about the airport authority. He has served faithfully for one term. There's a little bit of a disconnect for me between appointing Craig Blonigan and the issue that Commissioner Bertram brought up. Now, if we're going to table it, that's fine, but I think the focus should not be on an individual member of the authority, because clearly there are other issues that need to be discussed.
Commissioner Clark?
And Mr. Chair, I concur with that. I wasn't probably clear enough in my comments. I don't think this should be about him, but it is our way to send a message to the board.
Bringing attention to the concern.
But he's done a great job. I concur with that.
Yes, he has. And if we table it, can we have that on next agenda?
You can table it to a date specific, which
Well, I
in
would
this
say
case
let's,
sounds like the right thing to do.
yep,
Yes.
table it to the June
Yep.
24th
Okay.
meeting. Okay,
And Mr. Chairman, in response to that, the first thing I said was Mr. Blonigan's a good guy. He's certainly qualified. And I guess the old adage I live by, if you keep doing what you're doing, you're going to keep getting what you're getting. When you've got a board, it's always unanimous. Nobody objected to going into closed session. Mr. Blonigan, I don't believe, was a part of the meeting. I don't remember him being on Zoom. He was not in the room. But again, not personal. I did the same thing with Mr. Weirs the last time we had a reappointment. We need to send a signal. And in Mr. Weirs' case, and I think if we went out for applications, I think we'd get those again. Former Commissioner Jeff Mergen applied for it. We talked about having elected officials on the board, and we kind of didn't agree on that, all 5 parties. So I thought, well, that's a good way to meet that goal, having a former county commissioner, former elected official being on it. So there are other options. These aren't the only people that can serve on the airport board. I mean, we do have other very qualified people. And the biggest thing that concerns me is if you read all the minutes, and I've done that, it's consistent. There's no split votes. There's no, and again, so if you keep doing what you're doing, you're going to keep getting what you're getting, and that's why I'm bringing this up.
Commissioner Johnson?
Thank you, Mr. Chair. Everyone voting in the same direction can be a sign of unanimity. It can be a sign of people researching the work, doing a really good job, and making a decision. It happens all the time.
Yep.
Again, there are obviously many more issues to talk about here. And I personally think we should do the appointment, maybe have a meeting with the airport authority, but talk about all those other things that are leading to this particular issue. Because it just doesn't seem germane to what's really happening. Not appointing Craig.
Thank you, Commissioner Johnson. And to be quite honest, I'm going to vote against the motion to table it. So just wanted to put that out there because I don't feel this is the appropriate thing to do, but I will go along with the motion. Commissioner Clark?
Yes, I was just trying to find some common ground. First and foremost, I absolutely believe that Mr. Blonigan should be reappointed. I don't think we should be looking any further. He absolutely should be reappointed. I certainly also agree that the two are not necessarily connected, especially now that I'm hearing that he may not have even been at the meeting. It's kind of hard to object if you're not at a meeting, so I don't know what's said. And then lastly, serve on plenty of things that there are unanimity and votes, and it's not because people haven't done the work or that they're just rubber stamping. The reason why I was suggesting this is I also agree that there's got to be a way to be redrawing attention. And perhaps if it was that they were going to, if the chair and the director would be coming to our next meeting and we could guarantee that, I'd be okay with that. But I'm okay with doing it for one time, but I'm not looking to appoint somebody else. I think Mr. Blonigan's doing a fine job.
Okay, so the motion is to table this item F15, the appointment, until June 24th. All those in
I haven't had my
Commissioner
chance
Persky.
to speak yet. Yeah, when we talk about the whole agreement at the airport, when that came to us, that was a rather contentious issue, and we had considerable amount of discussion. And I was in opposition to it, and actually that would have killed it. I was advised as how it was going to operate and told that this was going to be the situation. And I did change my mind in good faith, thinking that they were going to operate in good faith. The ability to levy was not discussed. We talked about the St. Cloud operating it for 10 years and not necessarily that authority. And that we would have the opportunity to go back and tweak things. However, with the agreement that it has to take all bodies to make changes, makes it rather difficult to make changes from one side or one point or another. So I have a little bit of voter remorse being where we are than where I thought we were going. By all means, I support that airport. I think it's something that keeps the region viable and also will be extremely important for the future as well. But just the way it has turned out, I'm concerned about the way they are operating, and having more discussion about them on their operations would be healthy for us.
Okay. With that, no further comments. We'll call for the vote on tabling item F15, the reappointment to the Airport Commission. All those in favor signify by saying aye.
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 Opposed? Aye. Roll call, Randy.
Aye.
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 Nay.
Nay. Okay, thank you. Motion passes. Next item, F20. Commissioner Persky.
Thank you, Mr. Chair. Yeah, I see we have approval of liquor license for the next year. Interesting, I see that in St. Joe Township, Milk and Honey has applied to re-up their liquor license for the next year. The township has put in an ordinance as far as noises control, and I'm just concerned that, that ordinance is going to be followed. So Randy, I'm just wondering that ordinance then did come into your office. Did it come through the township or not?
Yeah, the liquor license it has to be approved by the township first, and it was. And then they do have their insurance fees paid, and then it has to get approved by the attorney, county attorney and the county sheriff, and all of that's happened.
Okay, and they didn't put any, obviously if they approved it, they didn't say anything about any violations or anything?
We're not aware of any violations
Okay, all right,
on the liquor side of it, liquor license side of it.
okay, all right. Yeah, because it's something new out there, and I'm hoping that they've come to an agreement as far as the way they're gonna be operating. So with that, I'll go ahead and I'll move item 20 for approval.
Second. We have a motion and a second. Any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Thank you. Thanks for the discussion. Again, as has been said in the past, we have 23 items, which is a lot, and we, at least I pay attention to what they are. And if you look at the claims paid, which was really high, I think it was what, 35 million, which basically was the distribution of the first half of the property tax to the appropriate bodies. So thank you. Next up, Auditor Treasurer.
I'm going to turn it over to Laura and Roxanne to go over the canvassing board appointees.
Okay, good morning, Mr. Chair and Commissioners. We are here today to appoint 2 commissioners to the canvassing board for the primary election, which is on August. The canvass we are wanting to have on August 14th at 3 p.m. and then also appoint the canvassing board for the general election for November 6th at 11 a.m. For the primary, we do not have any commissioners on the ballot, so it can be any one of you. In November, some of you will be on the ballot, so it has to be the people that are not on the ballot, which
That'll be the easy one.
makes it easy, right?
Okay,
Mr. Chairman, I'd
Commissioner
move
Bertram.
that the chair and the vice chair are on for the primary, and then Commissioner Notch and Persky for the general.
Okay.
So the same two people.
Same two people.
Well, I just thought I'd say it in a different way.
Okay, we have a motion to have the chair and vice chair be representative on both of those two. Is there a second?
I was going to say, I'm happy to second that Commissioner Notch and Commissioner Persky doing it. Not because you're chair and vice chair, though.
Okay, we have a second. Further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
Mr. Chairman, I didn't
Yes,
recognize
sir.
Roxanne because she wasn't blushing this time, so. Last time you were blushing, so.
Thank you.
Okay, thank you. Next up, environmental services. Good morning.
Good morning, Mr. Chair, members of the board. Shelley Benson, Environmental Services Director, and I have Becky Schlorf and Emily Forboard here to review the agenda item.
Good morning, Commissioners. Becky Schlorf, Environmental Services. The item before you for a decision is the Sauk River Watershed Collaborative Fiscal Agent Agreement Amendment. As you might remember, on May 12th, you did approve unanimously to vacate the position of fiscal agent for the Sauk River Watershed Collaborative. And since then, the Environmental Services has provided notice to our partners in the collaborative of that. And then on May 21st, the policy committee members met and made a recommendation that the partners approve the fiscal agent agreement amendment, recommending as well the Soil and Water Conservation District at Stearns County for the new fiscal agent. That would become effective and the funds would be transferred on July 31st of 2026. And the Stearns County Attorney's Office did draft this document as well. So if you have any questions, you can answer those.
Okay, we looking for a motion to approve of that agreement?
So move.
Okay, thank you, Commissioner Bertram.
second.
Thank you, Commissioner Persky. Further discussion? Any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
Mr. Chair, we do have a miscellaneous item for you related to aquatic invasive species, and I will let Becky review that as well.
Yes, so I did notify the county board that late last Wednesday, we did receive notice from our contractor, Water Guards, that they were immediately shutting down. And so we have consulted with procurement as well as the county attorney's office on Thursday. Chad May is here as well. We informed the lake associations or contacts rather that we had doing with inspections. And then on Friday, we were informed that Water Guards signed an agreement with a prior owner to handle the day-to-day operations. And we've heard that the inspections did occur on this over the weekend. And we are continuing to work with the DNR and Water Guards to help assure the inspections continue for the rest of the season. And so I don't know if Chad wants to provide any further updates or information, or if you have any questions regarding this.
So with the ownership change, there's no agreements that really need to,
There might be.
okay.
The previous owner, Nick, who we do have the current contract with, he is entering into a management agreement with Water Guards, so that, and he's done it before, so that's how we were able to kind of get a seamless, transition there. We are looking to get a copy of that so we can document that that's the business arrangement, that Water Guards is still the contract that we're going through, and then there's a management agreement with Nick.
Okay, thank you. Anybody else?
I got a
Commissioner
question.
Persky?
Yeah, Becky, how are we doing on that battle with invasive species? Are we winning? Are we losing? Are we holding ground?
Mr. Chair, Commissioner Persky, every year it seems, and we've reported this at the annual update that we provide, but there does seem to be a new infestation in at least one lake in the Stearns County jurisdiction. But the inspections tend to help at least educate, if not prevent, some of those AIS from entering the lakes and rivers and such, so.
Okay. Commissioner Johnson.
Thank you, Mr. Chair. Becky, I had heard, I think, last fall that there was a reduction to the extent of 50% of funding for inspections for invasive species. Is that still the case? And how is that impacting this arrangement?
Yep, Commissioner Johnson, the reduction is coming July 1st of 2027, based on the legislative action that was taken. And so with the way that we use our funds and budget, we will not see that impact of 50% reduction until calendar year 2028. So that season, we will see a 50% reduction, so it's about $125,000 less. And so the AIS committee that we work with have been brainstorming on different ways that we might utilize the funds to maybe do the inspections differently or just change the way that we're going about things. So you might be hearing more about that as we continue to work through that.
Sure. Thank you very much. Thanks.
Commissioner Bertram.
Mr. Chairman, the reduction obviously was the first news that the lakes, this does affect, the testing does affect 9 lakes. So, I mean, this is a big deal. And with the decrease in the funding coming to the future, and also now this, obviously, it's a big deal. And let's remind all of us that boats aren't the only way the species are transmitted. I mean, they're by birds, a lot of other ways, but this certainly is a big thing, and they do their job well and certainly prevent some of the issues. So this is a big deal, and I'm glad it got kind of worked out pretty quickly after you got notified that they weren't going to do it, so.
Yeah, Mr. Chair, if I might just add too, the vendor that we're working with currently is not the only vendor out there. So as of right now, there are a few others that could do that sort of staffing in the future if needed.
Thank you. Any other comments, issues, concerns? Thank you.
Thank you.
That's all we have, unless you have any.
Anybody have anything for Shelley?
Well, we don't have time for that.
Okay. Nope, I guess not. Okay, with that, we will recess our regular meeting and we will open the Human Services Board meeting. Morning, Melissa.
Good morning, Mr. Chair, Commissioners. Melissa Huberty, I'm the Human Services Administrator. There are 3 items on the Human Services agenda today. There are 2 on consent and 1 regular item. The 2 consent items, the first is J1 on page 269, and that is a request to approve a application to the Minnesota Department of Health for the Rural Health Transformation Program Child and Adolescent Mental Health Initiatives Grant. I did not name that. This is a grant out of the Department of Health. It was just very recently released in a very quick turnaround. And the grant funding is mostly going to go for our family and children's area in the area of prevention services. And we're actually hoping that if we get it, it will help to offset the impact of the act, the African American Child Welfare Disproportionality Act, which I also did not name, which will go into effect on January 1st, 2027. And if we do get this grant, I believe it would be for up to $400,000 per year for 5 years.
I'll move approval.
Second.
Okay. Thank you, Commissioner Clark. Commissioner Johnson, further discussion? Not seeing any. All those in favor signify by saying aye. Aye. Opposed? Motion carried.
Thank you. And then also J2 on page 272 is just claims paid on behalf of Human Services.
Okay.
I'll move those claims be approved.
Thank you, Commissioner Bertram. We have a second.
Second.
Thank you, Commissioner Persky.
Excuse me, Mr. Chair. I think it's just informational.
Was it?
It is, yeah.
Oh,
So it
okay, it's
needs
just
to-
accept.
just
Okay,
for information.
we'll disregard that.
All right. Okay, we have 1 item on the regular agenda today, and it is K1 on page 274, is to receive information on our anticipated state and federal impacts on public assistance programs. I have with me today Mike Pooler, who's the Human Services Director over the Economic Supports area, and 2 Human Services Supervisors, Audrey Norberg and Greta Stoll, who are going to talk to you about the direct and indirect impacts of what is coming in the next months and over the next months for the remaining of this year and starting into next year. So if you want to flip to the agenda on the slide. So today we're going to go over a timeline of the key Medicaid and SNAP policy changes that are beginning this year and through 2029, outline those direct and indirect impacts, and also outline the administrative impacts on county staff and the constituency. So with that, I'm going to pass it off to the director, Mike Pooler.
Good morning, Commissioners. This slide is not very legible. It's really just to kind of visualize the number of changes coming to us. The top half of the slide is state changes coming on the social services side. The bottom half of the slide is all of the Medicaid and SNAP changes. So this is basically a roadmap that was published. Again, it's poorly read. But speaking to the change, the bullet point on the bottom of the page, in 2025, we had more than 5 emails a week that came as an announcement just for healthcare for our workers. So it was 5 and change every week for the year. So that was the 270. So there's less than 270 working days. And 87 of those, and so that was more than 1 per week, had an actual policy, procedure, or process change. So it just want to speak to the resilience of the staff and the changes that are occurring, and that is going to continue now for the next couple of years.
And Mr. Chair, Commissioners, that leads into also the confusion on the part of the constituency as well. So when there's that many changes, policy changes and practice changes that the staff have to adjust to on a regular basis, it is also confusing for people who are supposed to be following these rules as well. So.
Thank you, Mr. Chair and Commissioners. My name is Greta Stoll. I am one of the Human Services Supervisors in the Economic Supports Division. I supervise our Community Healthcare Access Unit. So I supervise traditional medical assistance programming across both of our healthcare systems. The system I am going to focus on today is our MET system. I will try not to use that acronym, but it's going to be the system that has the most changes based on this timeline. So the new eligibility requirements that are going to directly affect our constituency is going to affect those ages 21 to 64 that are not pregnant, not receiving disability-based medical assistance, and who do not have dependent children. Those are going to be the clients that have the most direct impact to their eligibility. That's not to say that everyone else receiving our public assistance programs will not also be impacted by the administrative burden that these changes place on our staff. Our largest impacts are expected to begin in late 2026 and continue through 2027. In 2026, the changes are largely focused on specific eligibility groups, but from now on, June until the end of 2026, the largest focus is going to be communicating with our enrollees and preparing for the larger policy changes that begin January 1 of 2027. So June 15th and June 22nd, the first mailings are going to be going out from DHS. So, and then in mid-July, DHS is also planning on sending a text message regarding the increased renewals and the changes to the work and community engagement requirements for that population. Similarly, as we saw during the public health unwind, we obviously know that this proactive outreach is very necessary for our clients, but it also is a substantial driver to increasing client walk-ins, client phone calls, and requests for assistance from clients. We were able to see a preview of the mailer, and it does come in an envelope with a really big, scary red square on it that says important. And so we do anticipate a dramatic increase in client communication within the next month or two. And then in 2027, we do implement these major policy shifts, which is that that the adults without dependent children, ages 21 to 64, they will be renewing their coverage every 6 months instead of annually. And in addition to that, they will now have to comply with work and community engagement requirements to maintain their eligibility. HR1 also shortened the look back period, so any requests for retroactive coverage. However, the Minnesota State Legislature did pass funding to continue the existing look-back periods for at least the year of 2027. So that is no longer going to be, hopefully, as much of a concern for Minnesotans. There also, in 2027, is an addition of mandatory verifications for addresses, death records, and immigration status. In 2028, we will implement some programs. We'll have a cost sharing for specific services. So this would look similar to a copay for some clients based on their income, household income, and the federal poverty level. That cost sharing does not apply to primary care services, behavioral health services, and any services provided at certain federally qualified rural health centers. So there are obviously caveats to that. And then in 2029, the policy changes are going to be a federal system implemented that creates and prevents verification or enrollment in multiple states. And then there's also some waivers for payment error rates that end for Medicaid as well in 2029. So I'm now going to talk a little bit more about the direct impacts to our clients and to our staff. Obviously, some adults are going to lose their eligibility basis for medical assistance. That is going to be the most direct felt impact. And then in addition to that, the adults without dependent children population are going to face additional eligibility requirements to continue having their medical assistance, including those renewals required every 6 months and the work and community engagement requirements. There is going to be a substantial risk of coverage interruptions due to that missed paperwork. We already see that at renewals, that clients miss paperwork, miss verifications, and so we will see likely a dramatic increase in individuals falling off our programming and having to get back on their programming. And we will see that about every 6 months now instead of annually. And then we are also going to see an increase in denied applications and appeals because these work and community engagement requirements need to be met in the month prior to applying, which is going to be a different eligibility requirement than clients are used to having to meet. So we will see an increase in denials, we will see an increase in complaints for those denials, and we will see an increase in appeals for those denials. And then we also will see a dramatic increase in documentation and verification requirements with those address verification, death verification requirements, and immigration status requirements. In addition, the direct impacts, there's going to be a dramatic increase in confusion regarding the notices that are sent out. These are the mandatory or automatic notices that go out around renewal time, and then if clients miss their renewals or we do not have everything to process that, they will receive a closure notice, and those are sent automatically. So we will see those every 6 months rather than annually as well. And then in addition to the increase in appeals and requests for assistance. So there is going to be, beyond the direct impacts to these specific group of enrollees, we are going to see a significant impact on county operations and our customer service.
Can I ask a quick question before you go on? So have you kind of gone through the list and said, oh, we're going to have this many that potentially could fall into category? So you kind of have a rough idea of the scope of what you're looking at.
Yes, Mr. Chair. Specifically what Greta's speaking about, we know we have between 5,000 and 5,500 Medicaid recipients in that category of 21 to 64, single adults. So that'll be, again, it changes every month as people come on and fall off, that kind of thing. But between 5,000 and 5,500, that will be the additional renewals.
Okay.
And Mr. Chair, Commissioners, I would add to that the problem with our very old systems is we can't pull those 5,500 out of the system. So it means we end up going one by one to look for this every time we have applications come in. Otherwise, it would be a lot more simple to pull out those specific ones and make sure we gear towards that, but we can't.
Okay, thanks.
Yeah.
Thank you, Mr. Chair. Some of the indirect impacts we are going to see is that we are going to obviously have to process these additional notices and the requests for information that are sent to our participants. And we are also going to have to receive all of the documents and requested verifications. There will be, in addition, dramatic increase in phone calls and walk-in traffic for those seeking clarification or seeking assistance with their benefits, which leaves less staff time to process the true eligibility. And then there's a dramatic increase of procedural closures due to that missing information and those missing verifications. And in addition to that, the missed deadlines of having to report every 6 months. We are going to likely see an increase in complaints related to these notices, to the additional paperwork requirements. Like Mike said earlier, the policy changes are dramatic and they're very frequent, and so communication changes with these clients weekly. And so we could tell you one thing one day and then the policy changes and we have to tell you something different the next. So that's a lot of frustration for our clients to deal with. And then we are going to see additional technology and system changes that are required. Currently, MINIT, or the Minnesota IT department, is rolling out a private system that is supposed to interface with our public assistance system, or one of our healthcare systems. And in addition to that, they're requesting a third-party vendor to work with these working community engagement requirements. We're a little bit hesitant on that because the first line of verification is they're wanting our non-interoperable systems to be the first line of verification, and these systems have never communicated before, so I think we're all a little hesitant to be optimistic that they will start now. And then we are also going to be relying on a third-party data source to collect information from clients. That's going to cause a lot of client redirection. Everyone pretty much refers the clients to the county as the first source of information, and if we have to redirect them to a third party, that's going to cause additional client communication as well. And then we are relying on MINIT to make the technology changes to make our system, the system that my staff work in, compatible with these work and community engagement requirements, which have never been a part of this system before. And then we are obviously increasing the complexity of programming, so our eligibility specialists will have to learn the increasingly complex programming for these programs. And then there's the higher demand for customer service functions. And this is going to strain the processing timelines of all of our programs across the board, not just these medical assistance programs. And then I will talk a little bit about the administrative burden. So the increased eligibility workload, the renewals being processed twice as often, just specifically in this healthcare system, which is not the entirety of our medical assistance population. We average about 200 to 300 renewals from May to November, and then it increases from there. So December is over 450, and then January we average around 1,000 renewals needing to be manually processed, and then February to April is around 350. With those added renewals, we anticipate an additional 200 to 300 renewals per month and over 400 additional renewals in January to process. So that's obviously going to be additional documentation review and follow up with clients. And then those working community engagement requirements, we are again relying on non-interoperable systems to talk to each other all of a sudden. And then we are relying on clients to have that open communication with a third-party vendor, which can be uncomfortable in situations we've seen before. And then tracking those participation requirements and reviewing exemptions and good cause, which has never been something we've implemented in this system before. So we do, again, anticipate the increased constituent contacts, which is going to take away from processing our ability to process cases in a more timely fashion, in addition to the increased complaints and escalations. So all of these changes are going to dramatically impact our operations and create obviously an additional burden on our clients and our constituents, in addition to our staff and the people that we serve every day.
Thank you. Commissioner Clark, you had a comment?
Questions? Yeah. Thank you. I will get this eventually. Thank you for this. Recognize, and no, it's a lot of work, so please thank the team. Recognizing this is a fastly moving area, and at least as it relates to medical assistance or Medicaid, it's still evolving. So noting that, conversations clearly with the state, as well as what we know within our county, is many of the people who are subject to the requirements most likely have a medical or mental health situation that would exempt them but we don't necessarily know that or have the verifications needed. They might not even have a provider. So if you could just talk first just a little bit about what's really needed to help people. And I know that we've got a couple folks here who are looking for how external people can help, but just kind of speeding that up. It's an ongoing challenge. You know, they may or may not even be an epic for their provider. So how are we getting people connected to get some help there? You talked very briefly about the transitory nature of some folks. They may be in one county, they may be in another county very quickly. They may not have a residence that we can actually get to sometimes, so I'm curious about that. And then how, if at all, do you see EVA being able to help with this? Noting the lack of interoperability to begin with.
Mr. Chair, Commissioner Clark, those lovely questions.
Sorry, in 30 seconds or less.
I'm going to go in reverse order because I remember it that way. Yes, we are progressing actually pretty nicely with Eva, our AI assistant. We do have a technology slide. I'll touch base at a little bit later, but she is answering more phone calls now than ever. We have pushed her out front a little bit. We have had really good engagement, and there are other counties that have now joined. So we have a user group. We have a lot more power of smart people than just the Stearns County staff, which is awesome. So as more counties join, that more intelligence gets built in regularly. So that is exciting. We're trying our best to create, data and metrics to be able to report that out as well. But that is going quite well. And we will be creating specific intelligence around the HR1 stuff, like with the public notices that are going out and that kind of thing. And obviously underlying with all this, it's going to be fear, right? So we're going to have, you're going to get a letter. The public health emergency unwind did not go as well as DHS, I think, thinks it did. When I say that, the state DHS, there was a lot of fear and crossover. So you guys have all understood when we talk about churn and the complexities in mail crossing in the things crossing in the mail. I sent my verifications in. Yes, we got them, but the automatic notification went out from St. Paul. So there's a lot of that that's still going to happen. So I think just us being here today, just that transparency for the constituency to hear the fact that there is going to be a lot of unknown. There will be fear, and we're going to try our best to help navigate through that. The work engagements, I don't know that anybody's really saying there's anything bad that happened with all these laws that were passed. It's a systemic issue of the systems not being able to keep up versus like program alignment, for instance. If you're just on food support and medical assistance and you're doing twice a year on each of those, now 4 months out of the 12, you're having to supply information to the Human Services Department and we're telling you you're not doing it right. Or you might have, and it might be back-to-back months. And it is very confusing to the constituency and the clients to be able, I just did that, yes, but it doesn't work for this program. So they hear that from us. And so that's where, as you guys, as commissioners, receive phone calls and the confusion. And that's, I think, like I said, from just a transparency sense, being able to be here and talk about that today. As far as how do we help, there are a lot of good community interactions, organizations. There are navigators out there that this is their job, helping navigate the medical assistance, Medicaid, whether or not that's Mid-Minnesota Legal Aid, Catholic Charities, Abriva Health. So we do have community partners that they specialize in this. So we do refer people to them quite often. Anybody that might struggle or have a gap in being able to navigate all of the complexities that we're talking about, because that's outside the scope of what we're able to do on a day-to-day basis. So we do make referrals to those folks quite regularly.
How about the people, excuse me, thank you, Mr. Chair. How about the people who are moving? They're very transitory. They may not have a place. So whether they're unsheltered now or they're going from a group home to some other place, again, they may meet the requirements, but we don't have documentation yet. But you may not even know exactly where they are. And I know we've got outreach workers, but perhaps for the public or the people who might need help to understand.
Thank you, Mr. Chair. Commissioner Clark. We accept any application for anyone who is unhoused in our community. We will process that application to approval or denial, and then beyond that, we will transfer it to wherever they're currently residing for the county to service it. I would continue to encourage people to come into the service center if they have transportation available. It is on the bus line if you have a bus pass as well. And then we do work with our community connectors to try and get them connected with our social services programming as well, to see if that outreach can help, is specifically for the medical assistance side of things.
And just to complete that circle, it's really important for people to know that we might not have the resources to do everything. We have community partners, and you could still get your application sent in and we can get it to the right place.
Commissioner Johnson.
Thank you, Mr. Chair, and thank you for the presentation. Appreciate it. It's really nice to have experts like you, and I know it's a lot of work for you to continually keep up with this, and it's very much appreciated. You talked about the impact to us, the county, basically. You didn't mention the dollars, and there are going to be significant dollars associated with the need to do this additional work over time in subsequent budgets. And so that's a challenge that we have to face, and I know your department can help us with that. I'm thinking a lot about the other side, which is kind of heartbreaking if you think about it. When you talk about community engagement, people's obligation to either volunteer or work 80 hours a month, who may not have transportation. If they do, they may not have money for gas. There are all kinds of issues for the clients themselves. And we have to take that into consideration. And I think to some degree, that might be where nonprofits can help out a little bit with some of the things. But I'd like to hear from you about that, that obligation for community engagement, not only how you're tracking it and verifying it, but what the obstacles are for the clients. If I just mentioned one, but if you could talk about that for a minute. The other thing I'm wondering about is, does this now come clashing together with the revalidation of providers that some of these people are using? When 40% of the providers aren't being revalidated at this point, and we have to sort of wait and see what happens with that. Are they getting hit from both sides?
Mr. Chair, Commissioners, I can add, yes, this is coinciding exactly with the revalidation of the providers, which now the providers have a substantial amount of fear going on. Many are closing down. Many are saying, I don't even want to do this. I can't. So that is exactly happening. And on the cost side of the equation, and we haven't gone through SNAP yet, so we just did Medicaid. We're going to do SNAP next. But with both of these impacts of these programs, it is, we're forced in all counties, not just Stearns County, we're forced to either make the decision that we need to add staff. In Stearns County, to add one staff is roughly $100,000 for one staff for their salary and benefits. One staff member will not even touch this. We would need many staff members to help stay on top of that. So counties are forced to decide, are you going to use taxpayer dollars to help process and help people through this process, or are you going to receive a lot of complaints? And you're going to receive complaints anyway, so because it's very unnerving. There's nothing we can do to stop people being fearful and not being able to follow this process, because the public assistance system is just simply fundamentally broken. And we did not create this, but we are forced to work within it. So yes, there are large costs associated with this that we have yet to do, and we'll have to figure that out in the budget process of what you want to do with that. So, and if we can go through SNAP, then we can sum it up and we can answer any other questions. Would that make sense?
Yes.
Okay,
Mr.
so
Chair,
we'll quickly.
Melissa, before we move on,
Sure.
I want to comment. You know, there's considerable frustration and dismay about what's going on here. And I take a look at what the bureaucracy now is going to look like, what the technology cost is going to look like, and we're not increasing the quality of care for these people. We're the wealthiest nation in the world. We have the strongest military in the world, but we have a very poor healthcare system. And I just shake my head and wonder why we can't do better. Now we're going to have more people that are going to be without health care, and where are they going to end up? The only alternative they have is to go to the emergency room, and that just makes things even worse. and their conditions will be much more severe than had they gotten health care they needed in the first place. Thank you all for, presenting this to us, but it's just overwhelmingly disappointing to see where we're going with this. But I appreciate your efforts in trying to do the best we can with what we have. But somehow we've all got to be advocates to make the system change, because there's too many people that are not getting the care that they need, and we could get it to them as a nation and as a county. I'm sorry.
Okay, thank you. Well, yeah, let's finish the presentation if that's all right.
Yes. Good morning, Mr. Chair and Commissioners. My name is Audrey Norberg. I am a supervisor in the Economic Supports Division. I supervise our Adult Services Unit, so that's primarily single adults seeking food support or cash assistance. So I'm going to talk a little bit about the major SNAP policy changes. The bill was signed into law in July of 2025, and the SNAP changes started happening pretty rapidly. So in October of 2025, we saw the Thrifty Food Plan frozen. So this is the tool that the USDA uses to adjust benefit levels based on inflation. So those adjustments will still occur, they just won't be as frequent, and likely clients' benefits will struggle to keep pace with the rising food cost that we will see. Then moving on, in November of 2025, we saw the expanded work requirements and loss of some exemptions for SNAP. So work requirements have been a thing for SNAP. They just increased the age in which those are required to comply. So that increased from 54 to 64. And then we did lose many exemptions, including those for veterans, those for former foster youth, and also families. So families are no longer exempt unless you have a child under the age of 14 in your household. There was also a change in how shelter expenses work into a SNAP budget. So what this means is that clients will likely have rising housing costs, and that's not necessarily going to translate into increased food support for them as it has historically in the past. Looking into the future of this year, we will start phasing in the administrative cost share. So historically, counties had to pay 50% of administrative costs, and that's now going to increase to 75% that counties will need to pay. And then looking into the future, there's also going to be cost sharing associated with SNAP overpayments and our payment error rates. So just preliminary estimates have that anywhere from 1.3 to 3.9 million a year for Stearns County when that starts getting figured out.
And Mr. Chair, Commissioners, the payment error rate will be, we think, based on the state's error rate, not Stearns County's error rate. And last we checked, our error rate was 1%, but the state's at 10%, over 10%, so we'll pay the big rate, the 15% on that, so.
And just to follow up, Mr. Chair, on that, I think there have been some decisions being made around that, and I'm attending a meeting tomorrow to hopefully get some clarification on what that actually looks like. As far as we've been waiting for interpretation, the federal law clearly states that the state will take this on, but because we're county administered, we've been in limbo of assuming that the county might get passed, but we haven't seen it for sure. So I'm hoping we'll have more information on that soon to see what the state will take versus what the county's going to get kind of stuck with. So hopefully more to come on that relatively soon.
Yeah, go ahead, Audrey, sorry.
Yes, so looking at the direct and indirect impacts, so clients are going to lose benefits or receive reduced support due to the frozen benefit levels, the stricter work requirements, and the loss of those exemptions that I mentioned. We anticipate increased county workload because staff will have to spend more time tracking the increased work requirements. There's more documentation associated with those that staff will have to review, and clients will be responsible to turn that into us. And then also just the increase of appeals that Greta mentioned. When we have large policy changes like this, clients are confused by their denials and things like that, so they appeal the eligibility determinations much more frequently. One impact that bridges both the direct and indirect categories is the strain on the community resources. So as clients experience reduction in benefits or face eligibility barriers, we expect more individuals to turn to food shelves, nonprofits, and other crisis resources. So looking at the remaining indirect impacts, we will see processing slowdowns. Just as I mentioned, it takes more time to track those work requirements and review the additional documentation that is associated with those. And as staff devote more time to those activities, there'll be less time to be able to help clients navigate questions and concerns and things like that, which is concerning. Overall, we're likely to see the local economy just feel the loss as there's less food dollars circulating in our economy, and then that translates to families having to make tough budget decisions of whether am I going to pay rent or am I going to buy food this month. So it has a rippling effect throughout the economy as a whole. And when families are forced to make those tough budgeting decisions, household instability just increases overall, which is concerning.
And it generally means child protection increases about 9 months later after those reductions. Every time, at every point in history when we've reduced public assistance, about 9 months later, family and children sees a huge increase in out-of-home placement for children. So we can anticipate that on the other side.
And then, Mr. Chair, just to touch on the administrative burden, I kind of mentioned this and I don't want to repeat myself, but just the increase in staff time that it takes to monitor the work requirements and the additional documentation and appeals. The eligibility determinations are more complex with the budgeting changes and things like that, so it does take staff more time to make those determinations. And then we're facing this higher workload all while that federal administrative funding was cut for us as well.
Do you guys think this affects Minnesota more so than maybe the other 9 states that push it down because our computer systems are
Yes.
hindering the process? Because the efficiency is lost when you can't get these things working together. So I'm just wondering if Minnesota's in a more dire situation because we haven't kept up with the computers. I mean, you don't have to answer that now, but I'm just really curious if it's more of an issue seen in Minnesota than even some of the other states who might have a state whose computer systems are up to date.
Yeah, and Mr. Chair, Commissioners, I am on a nationwide group that, and every state is very worried about this, so I don't know that anyone has it down well. We do have a big problem because of our antiquated systems, but the legislature did approve $90 million, I think it was this last legislative cycle. Just know that the county staff will not see any change for at least a couple of years. So because it takes that long for them to, buy it, implement it, and hopefully we don't have a Min-Lars situation in the middle of it and that sort of thing. So it'll be at least a couple years before we see any change at the county level for the computer modernization.
Commissioner Bertram, did you have a question?
Mr. Chairman, well, I'm not sure, do you pass out depression medication? I mean, if you wanted to give an uplifting report, it certainly isn't that. Part of it is, can you, I assume you're going to be putting this on their website and reaching as many people as you can. You and I and Mike have talked way more than what I'd like to talk to with the residents because they don't know what's going on. The facilities don't know what's going on. And the people that are impacted by this, can we do a 2-3 sentence, that you can share with us that we can put out on our informational pieces and get it on the website and prep people that this is the reality and that it is. I mean, you hate to point the finger. I hate blaming other people, and yet it is a federal and state government that's doing this. So, but we need to prep them and tell them what the reality is. So if you can do that for us and for yourself, again, it's got to be 10 seconds because otherwise we're going to lose them. But if you can do that, and the providers, I mean, talking to the providers as we have been discussing, that's an important part of that. And the reality of it is, again, we got the whole spectrum of people that are affected by this. A lot of this is fraud driven. So they're having to do the reports over and over again because there's people out there, in a small percentage that have applied that shouldn't be getting it. And then, of course, that's what they're trying to root out. So then you make them do more paperwork, and then the legitimate people can't get it as quickly. So it's a vicious circle. And if you make it too easy, people commit fraud. If you don't make it hard enough, or if you make it harder, then you exclude some of the people. From my research is about 1/4 of the residents are in some kind of, in Stearns County, are in some kind of assistance program, which is kind of, that's out there for me. Because I can tell you my family, my mom and dad, and we never did this. And when people say, when they hear this, they say, well, we're not affected by your private pay. You're paying your own way. You bury yourself. You don't expect the government to do that. You have your own health care. And I'm not saying that the needs are out there. I get that. But 1/4 of the residents, that's a lot of residents. That's a lot of public assistance. But 3/4 of the residents aren't affected by this because they don't see this, directly. And I'm not, again, that's not a judgment, it's reality. You talk about the medical, we've got people using the medical system that really shouldn't be going to the emergency room or anything. Our nephew recently was in the emergency room, and there was drug addicts in the middle of the day spread out all over the floor vomiting, based on our sister-in-law, my sister-in-law and my wife's sister report. Disgusting. I mean, this is something, they're doing that to themselves. That's different than getting in a car accident or having a heart attack or something. You're inflicting this to your, and you're taking away the medical care for legitimate, what I would call legitimate reasons. You're doing this to yourself. So it's troubling all the way around. I mean, and like you said, that's the most troubling. So the assistance, all this stuff happens, and then parents take it out on their children. They're not getting and again, that cycle of, that's really unfortunate. But yeah, let's just try to get the word out on this the best we can. And you're still gonna get people that say, well, I didn't read it, I didn't see it, I get that. But there's a lot of frustration out there from people that do need it, that can't get on it because the phones are backed up and all this other stuff is going on. So, yeah, thank you for doing the best you can.
Yeah, no, I appreciate it, Mr. Chair, Commissioner Bertram. We are working with the communications team to hit multiple platforms as well. So we've been on the radio. Melissa and I went on the radio a couple weeks ago, but we'll also work with the communications team to get it on our social media. Ultimately, the state, one thing that they do quite well is they do have a single point of contact for this expectations. So we're going to redirect to that as much as possible because of the changes that they make. That will be the root source. So we'll do as much as we can specific to Stearns County and utilize the state. And they do have a relatively good website created specifically for this topic versus trying to navigate all of it. So,
Commissioner Clark.
Thank you, Mr. Chair. Yes, all these programs can get to be very complicated and confusing about demographics or who Congress or the state's trying to deal with. And clearly, on a provider standpoint, Minnesota has had a problem with fraud with some providers. My understanding is what Congress was trying to do is say, hey, certain people should be working. It wasn't about fraud. It was just they should be working or they should be volunteering. What's hard is we do have the old technology. What's hard is a number of those folks actually can't work. And so it's hard to go ahead and get all those things put together. People who are living in skilled nursing facilities are not the target groups for this particular thing. But that's frustrating too, right? Because, if former Commissioner Lensmeyer was still here, he'd remind us all that the single biggest public cost is for seniors at the end of life, even people who had been providing their own health care forever. So I appreciate that you try to help us, but the broader public understand too, because the truth is, even if it is a fraction, and I think it's actually lower than a quarter, but even if it's a fraction of who is at some point in life getting some help from an economic support standpoint, they have family members, they have friends, they have their community, so it impacts much broader. So just thinking about the struggles that people might be going through. The reason why we're here is to make sure that people who are eligible to get assistance can. And of course, we want people to be as self-sufficient as possible. So thank you again.
Yeah.
So we have a little bit on technology, which is slightly less depressing, and maybe, and then we'll sum it up. Go ahead.
I got a question on the SNAP.
Yeah.
What are the
Can we
SNAP benefits?
turn your microphone on, please?
Generally, what are the SNAP benefits for a family or individual? What are the maximums? How much money is actually going to the individual monthly?
it's a sliding scale based on that.
Right.
Yes.
Yeah, so number of household, Audrey can probably speak more specifically.
Yes, thank you, Mr. Chair and Commissioner Persky. So yeah, it's very determinant on household composition and things like that. I think the maximum that an individual can receive, I'm not as familiar with families because then that brings in the MFIP program, which is a little bit different, but it's around $294 And that would be someone that's receiving the maximum deductions that they could receive as well, so that they are paying a rent or a mortgage,
Yeah.
and all of those things are included in their SNAP budget.
Okay.
Including like exemptions for some medical expenses. So an individual who has a lot of complications for medically, they would take that into
So
consideration.
that's the maximum amount? Is that, what's more the average amount, the typical amount per individual? Is it closer to 200? Is it closer to 150? Or do you have any idea?
Mr. Chair, Commissioner Persky, it's definitely less, and I can get the number for you. That was one thing that actually does live in the system. I can tell you the actual average for an individual, and actually it does, it's in the hundred and something.
Correct, and that's what I understand, is that the amount is actually under a couple $100, maybe 150 or so like that.
Yeah.
And so I just, again, when I take a look at the grocery prices today and see what the need is there and how much they're actually receiving is not significant
Correct.
for the amount of need that they have. Likewise, talk about frustration and dismay. So now high school students are going to be not included as far as making claims for the need. Now, I mean, when my kids went through high school, and if you got any kids, especially if they're involved in sports, the amount of food that they eat and the need that they have, and to think that that nutritional need isn't going to be met by people that would otherwise qualify had they been younger, does not make sense to me. And I don't know why necessarily that provision was put in there, but it just does not make sense when there's even a greater need when you've got kids at that level.
But is it because the schools have to provide the breakfast and the lunch?
It is not my understanding that that was taken into consideration. I think it had more to do with the work requirements.
Oh.
So assuming then mom is working or mom and dad are working now, then more money coming into the home, and so then they
Sure.
don't need the help.
All right, well, let's wrap this up.
All right, go ahead.
Thank you. So trying to be as uplifting as possible. Speaking of Eva earlier, like I said, our AI has seen some pretty good growth, and I expect over the next 6 months that's going to continue to grow. Like I said, that's been exciting. I just want to put a plug in for the staff. We have to make a decision every day on how to provide customer service, and as we know, the phones is an issue. And so while I'm hoping Eva continues to help with the phones, I can say that as we have become more timely in programs coming out of COVID, which we are better now than what we've been in the last 4 years, we've talked about 30,000 calls a month as our volume. That currently is down to 20,000. So we've cut those phone calls by a lot. And so, you know, it's coming out from different angles. Obviously, having AI, having people answering the phones because we are able to, but ultimately the work being more timely, I think, is what drives a lot of that. So outside of systemic issues with the programs being hard, it is definitely progressing, I think, in the right direction.
And just to clarify too, that the average phone call is about 20 minutes because nobody calls us and asks a very simple question. Otherwise, Eva's handling it already. Eva handles more complex questions, but every time we have a call that requires more than that, it requires the higher trained staff. Otherwise, the person goes away just more frustrated than before they contact us. So it takes at least an average of 20 minutes to hear the whole story, so specific to the person, and to actually help them. That actually takes the financial workers, the eligibility specialists, to do that work. So when we've up till this point, we're timely on applications. What we've done is we put almost, and counties do this across the nation, you put almost all your resources on processing the applications, not answering the phones. Because otherwise you have the problem where people are falling off healthcare all over the place. We are always in that, having to titrate that up and down. At this point in time, we're actually in a pretty good spot. We will not be in a pretty good spot come in a few months from now because this volume, as we described, will increase substantially. So I'll sum us up if you want to hit the last slide. So we've talked about this already. There's going to be an increased burden on constituents. I just want to highlight this part. There will be delays for inaccurate or incomplete reporting of any type. So when you apply for assistance, that is not when the clock starts. Nearly all the applications that come into the county for healthcare, which is where the complaints come from, it's almost always healthcare. I don't think we get complaints anywhere else almost. It's going to be on healthcare. That is not when the clock starts. The clock starts for counties when we have all of the accurate information, and nearly all the applications do not have complete or accurate information. So it's a back and forth. Once we have all of the accurate information, it's 45 to 60 days thereafter of processing. So it's a lengthy process to get on assistance for healthcare. We talked about the phone calls dramatically increasing, so I don't need to repeat some of that. So we talked about the workload being significantly increased and the renewals. Most people, or not most, many people who are on Medicaid are also on SNAP. Those renewals are twice a year now, and they're not at the same time. So if Medicaid's January and July, 2 months later, they're having to send the same paperwork in like 2 months later for SNAP. Then it's going to be March and September, let's say. So this is why you're hearing like, I just handed all this in, and most of the time it's not complete or accurate. And so they'll say, though, I did hand it in, and we still don't have the complete or accurate information. But we do go back and forth, and we get the paperwork eventually, and from that point, it's 45 or 60 days thereafter of processing time, because we process them in the order that we receive them. And so with that, we're available for any last questions.
Okay, well, that was definitely a mouthful.
Yeah.
Commissioner Johnson.
Thank you, Mr. Chair. Melissa, you and I talked about this a little bit ago, but I think I'd like you to say it out loud. There are lots of people who may want to help people do their paperwork, do their applications, but there are reasons why they can't.
Correct.
And I would like you to talk about that, especially from a fraud perspective.
So there are navigators that are certified to help people do this, so that they're trained to make sure that you're not helping engage in fraud, for example. So my staff cannot help people fill out their applications. If they did, it would be like me asking, Mr. Pooler, what's your income? I'm the staff member. He tells me he doesn't make any income. I'm now entering in the system that he doesn't work. And now I'm a party to his situation that I cannot verify. So staff cannot do this. It's certified navigators. And years ago, the counties did hire, they tried dabbling in hiring navigators, but it didn't work out. So now we go to these outside resources and we send people. Everybody else who does not require assistance for navigation does it on their own. And of course, it's extremely complex. And so there's a lot of confusion around that. So,
do you have a list of certified navigators in the community?
You do have a list of the providers that we refer to. We don't pick for people either. We try to say, here's a list of things you call. And
that might be good information to include as these changes are occurring.
Yes, yeah.
Which could possibly be put on the website, maybe.
Yep.
Thanks.
Commissioner Clark.
Sorry, Mr. Chair, recognizing
Please
we're
turn your
trying to
microphone
move
on.
Recognizing we're trying to move on, this relates to the last piece that you talked about the length of processing that it takes. To tie that back to the look-back period, right? This is why it had been important. Somebody applies, it takes a while to process. So the way the law, at least as originally designed, was that you could go back to 90 days from the date you apply. And particularly for seniors, going back to the seniors in skilled nursing facilities and their families trying to work through this, it could take 90 days because you're trying to get all those applications and it just takes a long time to process. If the state does not continue to pay next year, it will be 30 days. So we will still need the 60 to 90 days to process, but people will only get coverage for whatever length of time they look back. And that's why that's important.
Correct.
Okay, thank you.
One more question. Melissa, with the application being renewed every 6 months, do they have to start a new application, or can they just say, no changes and resubmit the existing one?
Oh, no.
That's a good question, Mr. Chair. Commissioner Persky. On the Met side, which is, I'll stop using Mets, but on the Medicaid side for the 18 to 64-year-olds and families, I believe the renewal goes out, filled out with current information, asking for changes.
Okay.
So that's, when we've presented before, I forget that that's the 17-page application. It's in the teens number of pages. The system does send it out. So basically they say, is there obviously employment change? Is there household composition change? Which will get caught at renewal time, but it's also on the we talk about rights and responsibilities. Clients have rights, but they have responsibilities. Those are things that people need to self-report on the fly as well. So if you have an employment change, technically speaking, you're to report that to the county within 10 days of those changes. So, that's the ebb and flow of always constantly updating information, but to answer your question, it does go filled out.
Okay.
Many of the concerns that you hear about are people applying for health care for the first time Medicaid, and they have inappropriate, they don't know it, but it's inappropriate asset transfers. And we will catch that. We have to catch that. We will get that, and then starts the back and forth. That's why it's many months, but by the time somebody's actually on assistance.
Mike, did you have something?
I was just going to follow that with Melissa. It's a 5-year look back. So I think that's when families have a lot of confusion about the fact that this happened a long time ago. It did. But asset transfers are a 5-year look back. So when my staff look into things and all of a sudden $50,000 gets taken out of a savings account 4 years ago, so that triggers all of the back and forth with families and the displeasure, I would say. So, yeah, thank you.
Okay. Thank you. Well, thank you for that, and I'm
Okay.
sure there'll be more to come in the near future.
We'll be back to give updates as we go along. So
Okay,
thank you.
Thank you. Thank you for coming. Okay, we will close the Human Services Board, reconvene the regular board meeting. Is everybody up for a break? Okay, we'll take a 5-minute break. There we go. We're up and at it. Okay, good morning, Ben.
Yeah, good morning, Mr. Chair, Commissioners. Ben Anderson, Parks Director. The item I have in front of you this morning is we're asking you to consider approving a G&M contract change order and to authorize county staff to execute any subsequent change orders. So as you may recall, back last fall, we initially bid out the Kramer Lake Wildwood Phase 1 development project. For this project specifically, we have both a state grant and county dollars that are already allocated to it. Unfortunately, when we bid it out the first time, the bids came back 25% over our identified budget. So at that time, we asked the board to reject those bids so that we could go back and rescope the project to get as much done as we could within the budget that we had identified. So we did that. We went back and rebid, and this spring we had good news in that the project came back way under budget. But what that did is mean we get to add some of our other items back in. So today that's really what you're seeing. Some of the smaller change orders 1, 2, 3 that were included in the packet are just some typical, a culvert was completely couldn't be utilized, so we had to replace it. There was a bigger culvert requested by County Highway under the entrance road off the county road, and then some additional fabric that we needed to sturdy up the road. But the change order that ultimately led us here today is a policy that requires any change orders that exceed the 10% of the original contract value need to come back to board and be approved by that. So what we are asking is to add back in some additional trail. And you were all handed out a handout that has the additional trail highlighted in it. That's a 1/4 mile of trail that would create a loop essentially out at the park. So the change order number 4 is the requested amount is the $133,672. That falls within the pricing that G&M had originally provided us for this, and that has been vetted by our engineer, SRF, and also the procurement office.
Okay. So we'd be looking for a motion to approve the G&M contract change orders.
So moved.
Thank you, Commissioner Clark.
Second.
Thank you, Commissioner Johnson. Further discussion? Any further discussion?
Mr. Chair?
Yes.
If I could just clarify on the motion as well, just as it reads on here. We are also asking the county board to authorize the Parks Department and procurement to work together for any additional change orders as long as we don't exceed that initial budget, so we don't have to come back here on after to ask for approval of those.
Is
Yes, and that was my intent.
supplemental to your motion?
Yes.
Okay. Thank you, Ben, for the clarification. Any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
Thank you.
Thanks, Ben. All right, next up is administration.
Thank you, Mr. Chair. We have a couple of things, well, actually 3 if you count the closed session under administration. The first is the logo redesign, and you talked about this a couple of meetings ago. I think, just to remind you, we were going down a path of updating the logo and branding a few years ago, and then we didn't come up with any solutions. And then we restarted that effort because if we are going to have a new brand, we wanted to incorporate that into the new Justice Center. And I think we've gone down a path that's been a little better, come up with some better results this time. And you can see most of them are really a refresh of our current logo. But I'm going to turn it over to Jill, and we have guests here that were a key part of creating these new options as well.
Mr. Chair. Morning. So we are pleased to have with us today 3 people from the Northway Group, which is part of the St. Cloud Technical and Community College program that does this design work. And so we have Ava Peters, Cheryl Workman, and Emma Reverman. And you'll see that Ava was listed on the agenda, but the other two weren't because we weren't sure of their schedules. And partly because Emma is on jury duty right now and actually had to go in today. So we're so happy that she was able to make it. But as Mike reviewed, we talked through this time if we wanted to do a refresh or a total new design, and I think we kind of ended up in the middle. But you'll notice with our prior design, it's hard to replicate with that kind of color ombre, and just taking an opportunity to do something different. So as the team in the back bring up the presentation here, I'll let these three take it away and present the three options for you guys to pick from. Oh, and I'll note that in front of you, Commissioner Bertram had requested kind of a letterhead. So this is our attempt at just taking them and putting them on administration letterhead, just so you can see how it's printed. But it's not real tight design, I would say. So it will look better when we use the specs that are sent from the program.
Good morning, everyone, and I'm so glad to be here because I didn't think I was going to be able to make it. This will also be a little bit of an informal presentation because I wasn't super prepared, but I wanted to talk about a little bit of the background into my design process. One of the big things that I really wanted was to make it more of a refresh and incorporate some of the ideas that are already used within the logo design. I wanted to draw inspiration from both the compass and the North Star because they're two symbols that represent Stearns County. And then I also wanted to maintain a cohesive design with the current website design because I know that was recently redesigned. So I tried to use similar typefaces, similar colors as what are already being used. And yeah, this is the color palette that we kind of decided on. We wanted to keep the blues and golds. They do look a little bit different up there. The projectors always do that. But yeah, you can see we used the blues and the golds, and that's kind of the color palette that we based everything on. And then these are the fonts. So we kind of just went with the Poppins font, and it has a lot of different weights. Yeah. And so it can be used in many different ways. And this is the first option for the primary logo. This one obviously features the county outline, and then it also has that North Star compass shape, which is already used in the current design. And if you notice, the Stearns County, Minnesota text is actually almost identical to what's being used on the website right now. So I really liked that it incorporated what's already being used. And then this is the second option for the primary logo. This one, I decided not to use the county outline because I know we had talked about that being an option as well. And then it kind of just has that compass shape cut in half there. And then here is the third option with the courthouse in there and also that county outline. And then this kind of looks at some of the potential variations. So once we deliver the full brand guidelines, we'll have a horizontal logo, a vertical logo, and then also a submark. So these can be used in different ways. Maybe you want to use the submark as an icon, as, I don't know, a profile picture, it works good as. And then the horizontal works good as like a letterhead or anywhere that a horizontal just fits better than a vertical does. And these are still up for discussion. I just wanted to throw on what it could look like with all three together there.
So if I can, so which one's the sub?
What was that?
Which ones are the sub?
So the submarks are those ones that are just the like circles and then that county shape with, yep, with the courthouse in there.
Okay.
Yep. And then there's that horizontal one as well.
Okay.
So, Mr. Chair, just to touch, like she said, submarks are really common, like social media platforms. When you only have an opportunity to show something really small, people will start to become familiar with who you are just based on that icon. Right. So it's kind of a trimmed up, summed up version of your identity. And then, like she said, so you're not seeing, there's still the three main variations. You're just seeing how they would reorientate so that you can accommodate all instances and uses that you're going to need it for.
Okay. Thank you.
Mr. Chairman.
Yes, Commissioner.
I guess I'm confused. So we're going to use all of these?
No.
Okay, we're just going to use one consistently.
Yes.
Got it. I mean, that was what I thought we should be doing, is one logo consistently on everything.
Absolutely.
Got it.
We are only just showing this as an opportunity to see what it would look like in different orientations.
But it will be one of them on everything.
Well, so let me just clarify that a little bit. Again, like she was kind of touching on, you might run into a situation where maybe you have a large sign outside that's very long, but condensed. If you were to use, let's say, that middle top logo there, that's going to be really small in that really long sign. And so the variation still accommodates that same symbol, but puts it in a different location, allowing it to span and fulfill the whole space. Also, so it's easy to see and read as well. So what you're seeing on the left side is version 1, the middle is version 2, and the right side is version 3. Each of those contains a vertical, a horizontal, and a submark version.
And I know we did talk about maybe not liking that county shape in there, so what we could also do is use that center submark and horizontal variation with that first one as well. And like I said, they are up for discussion as well. We can definitely talk about how we want to change those.
Commissioner Johnson.
I like the color palette.
Thank you.
Yeah, that beigey sort of color bothered me. Yeah. I'm colorblind. Yeah, I like the color palette very much. I have a little issue when you start using the shape of the county, as in the bottom left there.
Yep.
Depending on where you're printing it, it looks like someone dropped a blob of ink.
Yep.
It's risky, I
Yeah.
think, because you don't know how it's going to turn out in certain settings, newspaper or whatever the case may be. The courthouse is interesting to me, but we were at an AMC meeting yesterday, and their logo includes the Capitol, so with the dome, Corinthian columns, they have a little additional spike on it and stuff. I personally like option 2. I think it's very clear.
Mm-hmm.
It's the circle, it's Stearns County, Minnesota, it's the North Star, it's the compass. It's very clear, and I'm not so sure that anybody needs to know the shape of the county, because it's so irregular. You know? If it was something dramatically unique, I guess that might make more sense. But so I've just shared my opinion, and if you want some action, I would be happy to make a motion that we accept option 2.
Commissioner Clark, you want to second it or make a?
I was going to make a comment before that. I could
I
second that.
don't need to make a motion,
if you-
but
okay.
at some point.
If you could go back to
They
the
want a
other one
decision.
really quickly. One of the things that surprised me when I saw these was I was concerned about the shape of our county being on there because we look kind of like Nebraska, et cetera. What pleasantly surprised me, I very much agree about the colored in county. It looks like a blob to me, but the overall one looks to me also like the sunrise as well as a compass, and the light touch of the outline on the first one. I liked that. So I mean, if you use the full compass on something where we needed to only have, the compass, I would personally be fine with that. But otherwise, I like number 2, option 2 a lot, and I would be quite content. In addition to the reason Commissioner Johnson just gave, my concern with the third one is that the historic courthouse will be around, but it's not going to be used as a historic courthouse in the next few years. So I don't want to really confuse folks, but all of them are lovely. So I would be okay with seconding that motion, but I don't know what other people are thinking.
Well, as I said, I didn't necessarily need to make a motion, so you don't have a motion in a second.
Okay. Commissioner Bertram.
I was more suggesting.
I like the middle one, so I wish Commissioner Johnson would make a motion.
All right, well.
Mr. Johnson, would you care to make a motion?
Then I will make a motion
And I
for
will second
option
it.
2.
We got a motion and a second. Discussion, Commissioner Persky, please turn your microphone on.
The color scheme looks quite good. My question would be, is that when we do black and white, does the yellow come out when you do black and white?
So when we do a true black and white, it would all be 100% black.
Okay.
Yep.
Mr. Chairman,
Commissioner Bertram.
Go to the next one where you have the cards. You have the black card That one.
Oh, yes, sorry.
What's the point of the right side? We wouldn't be doing that.
If there is a sorry, Mr. Chair, if there is a situation where you are placing your logo on a darker background, you're going to want lighter colors so that accessibility has been considered, and that's a big thing. I'm not sure if it's hit government, I'm assuming it has. Accessibility was at the core here when you see those lighter versions.
Because I think if you do the note cards or whatever, the left side obviously looks a lot sharper.
Mr. Chair, the majority of your versions will be on white, but we always have to, like we said, we're offering, so in any instance that you need that logo used, it's going to be accessible, visible, easy to see, easy to read. And so, yes, majority of the time will be the left, but when it's on a darker background, whatever that might be, you have that variation as well.
And then, Mr. Chairman, on the stationery, personally, I think this looks nice. I don't know if it's got to be one or the other, but I mean, this adds a little bit of color, I think. So, my 2 cents.
Okay. Any other comments? Commissioner Johnson?
Well, I will ask a question, sort of make a comment. Was there thought about putting this logo on a wall at the Justice Center?
Yeah.
Did that come up somewhere?
Yeah.
If that's really the case, that's another reason why I thought the courthouse shouldn't be on it.
Yeah.
Because that's not the courthouse.
Yeah.
Well, it will be the new courthouse, but it's different.
Yeah.
And
Yeah, I think we had a rendition earlier when we went through this first time where they showed it on the side of the wall inside the building. Yeah.
And
Okay.
Mr. Chairman, I just
Commissioner
want to say thank you. It's kind of exciting that we've got a school that's working on this, and you, hopefully you live well into your 90s and you'll be able to point and say, I was a part of that. So that's kind of neat.
Yes.
So thanks.
Thank you.
Okay, Commissioner Clark.
Yeah, the other thing I do like about this second option is if we're going to have it on the ground like we do currently have here,
In the rotunda.
it will be very striking. And I too just want to thank you. I was telling them I used to, when I worked at SCTCC as a dean, I had the Northway group was in my division, and it's still unique in the country, which is hard to believe, because having an actual ad agency that students and the community benefit from is a big deal, and your work is going to be all over. So that's pretty cool.
Yeah,
Yes.
that's nice.
Okay, we have a motion and a second. Seeing no further discussion, all those in favor of the logo choice indicate by stating aye.
Aye.
Aye. Opposed? Motion carried. Thank you. Thank you.
Mr. Chair and Commissioners, I just want to thank you for the opportunity that you've given the students to kind of run the show. I just stood back as the instructor, and thank you for the opportunity. It's wonderful.
Thank you so
Thank
much.
you.
Goosebumps.
Okay, there we got that finished. Now, the next item, the Jail Justice Center. Mr. Cornick, are you up? Kevin, are you up?
Kevin, you're up. He's excited about the logo too.
Yeah.
I got a lot of stuff I want
These
to
two
put
are on the committee, both of you, yeah.
And they probably liked a different one.
You'll never know. It's on my note, it's on my napkin.
Good morning.
I can read Mark, remember?
Good morning, Commissioners. Kevin Cornick, Facilities Manager here at Stearns County, and joining me today, Captain Mark Maslankowski. Between the two of us, we're project managing the Justice Center project. So before you today is a rather lengthy request for action. The first item on this request is to approve various scopes of work for the accessory building at the Justice Center project. The accessory building was, early in the process, was peeled out of the larger project when budget was a concern. As we worked through the process, the need became apparent that, we have to do something. So it was pushed back in, but under a little bit of a different procurement method, in that the county's going to self-perform the construction management for that facility. So Kraus Anderson Construction's handling the larger project. Mark and I'll construction manage this smaller piece. But So we went out for bids, and you will see there's one sheet in here that sort of summarizes our bid results and offers you a total at the end. In the construction budget, we currently have $5.5 million set aside for this accessory structure. And with what you see in front of you today, we're at $5.596 million. So we're just a little bit over budget from what our engineer's estimate was. However, I have one bid scope that far exceeded our engineering estimate, and we're recommending that scope of work be rejected and resolicited, and we can reach out to try and do a better job of drumming up some competition in that bid scope. We also have quite a few known value engineering items that we're working through with a couple of these. I don't really have a dollar value to put to that, but I think it's probably in excess of $100,000 in value engineering items that we're working through. So at the end of the day, I think this project will be right at our set budget. So with that, shoot, I'm a little bit going out of order here. Let me back up. Sorry, Mark, just said something.
He tried.
I didn't want to interrupt.
Yeah, well, kick me. Sorry, the first three actions on this board action actually do relate to the larger Justice Center project. Back in the May 2 meetings where we awarded and took other actions on contracts, we rejected 3 bids and went out for rebid on those. So we rejected our masonry scopes of work. There are 2, one focused on the jail and the rest focused on the remainder of the project. We rejected those bids because the line between got confusing throughout the 1,200 sheets of drawings. So we rebid those, and then we had some concerns with the elevator specifications that maybe we didn't offer up a fair shake to everybody, so we recommended to reject and rebid those. Those 3 bids were received, and we're recommending that we accept those 3 bids. The overall pricing was less than we had on the first round, so we'll have a net savings on those contracts of right around, I think it's about $500,000. So I don't have the exact number in front of me, but so those 3 bids came back well, and I'm very comfortable with both contractors that are our apparent low bids.
And maybe we'll look for a motion on that one separately.
The 3 together, correct? 3.
Correct.
I'll make that motion.
Okay, thank you,
Second.
Commissioner Bertram. Commissioner Clark, any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
All right, now I'm back on track. So the second part of your board action is the award of the list of apparent low bids for the accessory building at the Jail Justice Center. So this would be all of the scopes less 2 that we're recommending the apparent low bidder for award.
And Mr. Chairman, just for clarification,
Commissioner Bertram.
Kevin, when you keep saying apparent, you haven't finalized that yet, or why are you saying apparent?
Apparent low bid means that they have met the statutory requirements to be a qualified bidder. So they've submitted a bid bond, they've submitted the right paperwork, they're not disbarred. So we use the apparent low when on bid day, when they land, that's our apparent low. And then we vet them out after that to get to this process here today. So they're still our apparent low bid. We just qualified all of their information here today, so.
And that's 1 through 12.
Correct.
Okay.
So they won't be apparent after today.
Correct.
Mr. Chair, I'll move
Commissioner
approval
Clark.
of numbers 1 through 12.
Okay, thank you. Thank you, Commissioner Clark. Second from Commissioner Johnson. Further discussion? Not seeing any further discussion. All those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
All right. The next action item up is a resolution to accept the withdrawal of our first apparent low bidder and accept the second low bid for work scope 22A plumbing. We received a letter from that company asking to pull their bid from consideration because of some missed work scope. And we're recommending that we accept that letter, reject their low number, and move ahead with the second low bidder, Advantage Mechanical, and approve the resolution attached.
So move, Mr. Chairman.
Thank you, Commissioner Bertram.
Second.
Thank you, Commissioner Persky. Further discussion? Further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed?
Okay.
Motion carried.
The next action item is to adopt a resolution rejecting all bids and authorize a rebid for work scope 5A structural steel supply. This number that we received one single bid in this scope, and it far exceeded our engineer's estimate. At the same time, it came to our attention that that bidder included not only structural steel, but miscellaneous metals, rails, and stairs, which in our project is a separate bid package. We do not have a mechanism built into our specs to accept a combined bid. So with those two reasons, we're recommending rejection and rebid for that work scope.
Thank you, Commissioner Johnson.
Second.
Thank you, Commissioner Clark. Further discussion? Yeah, well, I'm assuming they were made aware of the situation. Okay.
We're made aware. Yep.
Seeing no further discussion, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
And the last item on your action list is the approval for procurement of some capital items related to construction and maintenance of the Justice Center. This would be equipment such as skid loaders, plows, and attachments that will be used both during construction for things that we have a contractual obligation to either supply equipment or pay for a rental. And then will be used in the subsequent operation of the building. The reason this is coming to you early is that if we use this equipment in the construction process, that makes it sales tax funds eligible. So we're able to use the sales tax dollars to pay for things that are used during construction. So I wrote a little narrative of what and why. If there's any questions on any of that, I'm happy to answer. Otherwise,
Mr. Chairman, Kevin, probably just share with you and I talked about where you're gonna store it.
Sure.
You know, because you're gonna have equipment, not a shed.
Yep.
Just maybe touch on that.
So most of this equipment will store on the Justice Center site during construction. The county owns some steel storage containers that will put this equipment in. If it's snow removal equipment that's seasonal, we'll probably bring it to Wake Park Highway and store it there when it's not being used. But all of the equipment will be on site and stay on site. And then we'll bring in some storage to protect it.
Okay. And the amount is $246,297?
Correct, yep.
Okay.
So move.
Okay, thank you, Commissioner Bertram. Can we get a second?
Second.
Thank you, Commissioner Persky. Any further discussion? Any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
I look forward to seeing all of you on Thursday for our formal ground break. 1 o'clock on site, rain or shine. I recommend a good pair of shoes or boots. It's a little damp out there after yesterday, but hopefully should have a dry pad and some tents and things like that. But definitely
Captain Mark,
recommend
you
a
got anything to say? Kevin's kind of stole the show from you a little.
The site is definitely wet. We definitely caution anybody coming to the site. We will be taking all of our traffic off of County Road 75, so there'll be a law enforcement presence out there to help get people in and out of the site. But everybody should plan on exiting towards St. Joe when they leave the site for that day, but just plan for, if you're coming to the site, plan accordingly and expect some slowdowns on County Road 75. It's a 60-mile-an-hour zone. And
So if you come from the west, you're gonna have to go into Wade Park, circle around and come back to the west.
it would be safest for you to do that. There isn't a turn lane coming from the west, so we'd prefer everybody circle in that way. We'll have a better traffic plan the day of as we see how things develop, but just plan to be early and be ready for some traffic situations on that road.
Okay.
So.
Okay.
Mark, you're saying the access is off 75?
We will be
Okay.
using the 75 exit or off of 75. We had hoped to have our road in off of 134. Just with the weather that we've had and the delay, we didn't get that done before groundbreaking. So,
Commissioner Persky can jog
Commissioner
from Sartell and go across the wetland.
You might be able to make it through on foot.
yeah.
All right. Okay, well, thank you for that, and we look forward to seeing everybody on Thursday. All right. Next item is issues by commissioners. Commissioner Bertram, do you have anything?
Nope, not really. Just the transition team stuff. I haven't shared my thoughts yet with Mike. I will, but we certainly need to have deeper discussion than what we've gotten, what I've gotten, and I haven't had a chance to do that. But just everybody obviously be aware of that. We should have a discussion. And then can you give me a job description for Jill, our expectation, salary, things like that, just to kind of compare that to what's going on here? I'd appreciate that. Thank you.
Okay, Commissioner Persky.
Just one item, that is, you had seen a letter from Mike about the city of St. Cloud meeting with stakeholders about the issues with the homeless. Commissioner Johnson and I attended a meeting with this mayor and members from city of St. Cloud, as well as some of the caregivers and folks from Place of Hope and Salvation Army, just looking at that issue. And that's something, we've been concerned about for a number of years as what to do with the homeless. On the positive side, there's some good things going on. Place of Hope West is doing some renovation to their facility and getting some rooms set for folks in need there too, as well as a Vivo coming up too. And we're going to look at maybe perhaps meeting on a more regular basis, maybe quarterly, preparing always for the winter with things, with the homeless population that we have, and maybe getting a better handle on meeting the needs of that population, whereas we've got so many groups that are intended to be good helpers, but oftentimes don't know necessarily what the direction is and how they can be helpful, as well as looking at the issue, making sure law enforcement is aware, this body is aware of what's going on, and maybe just having a better handle on the conditions of the homeless in the area, because it's not a Stearns County issue, it's not a Benton County issue, it's not Sherburne County or St. Cloud or Way Park or Sartell, it's our issue, and we hope to deal with it maybe more broadly, collectively, to do some things to help those folks. And maybe Commissioner Johnson can comment on it later as well.
Commissioner Clark.
Thanks. I'm sorry I was not at that meeting. Hopefully I will get notice of the next one. And agree with your comments there, Commissioner Persky. Excited about the groundbreaking on Thursday. Really appreciate all the work being done up to date. And in some ways, it's such a weird spot to be in that we've got all this positive, physical, obvious momentum moving forward on that, and the things that we heard earlier with a number of our residents just really facing a lot of critical, challenging times trying to get what helps them meet their basic needs. So it's a good reinforcement about all the things that we do. And then I guess on a very light note, Summertime by George starts next Wednesday, Killer V's. So because we won't be meeting again before then, I want to encourage people to come out and enjoy some good time and fellowship together.
Commissioner Johnson.
Thank you. Commissioner Persky described the meeting with the homeless. I don't need to add anything to that, but it's a real important issue. It really affects a lot of people. The discussion about Mr. Blonigan's re-upping on the airport authority made it really clear that we need to have a deep discussion about not the membership of the authority, but about the authority itself. And I don't have the experience that some of my other commissioner colleagues have, but I certainly know that the tax levying authority is part of that issue. I would like to request that we meet with the appropriate people on the authority, talk about what some of these issues are, talk them through, see where they went the wrong way relative to what my fellow commissioners here think, and how that can be righted, because it doesn't make any sense to have things that are sort of tangential, like the appointment of a commissioner to that authority, be impacted by what's underneath. So I'd like to actually request that we do something together with them. And then the last thing I'll say is that I'll be in Texas from Tuesday until Monday night before the next meeting, the Tuesday before, and I'll be back on Monday night before the next meeting. So I just want to let people know that.
Okay.
I think the next meeting is the 23rd.
Yes. Okay, and then on June 18th, I think everybody got the email that town officers are going to have a town hall, I believe, at Avon Township. I'm not sure if anybody can make it. I won't be able to make it, and I think Commissioner Bertram couldn't make it either, but I think you guys got it from Chad Van Beck, June 18th.
I haven't seen it, but,
Okay.
I'll
Well,
be,
it's probably coming because I just saw an email this morning, so you probably got one in the email. I think it's June 18th in the evening. The town officers
yeah,
are going to have a.
that's my Texas
They-
time.
Yeah, we're hoping, I think, to get some legislative staff there and people like that, plus a county commissioner if possible. And tomorrow night, I am going to the Sauk Center Township meeting for that road turn back project. And I think, Mike, you're going to Lake Henry I think, with the broadband again, so we'll be tackling that. And then, Randy, I don't know if at some point on the extension, do we have to discuss that as a whole?
Yeah, we certainly can.
Okay, yeah, we should probably look at doing that sometime soon too, because the decision will have to be made for the quad counties. Okay. Other than that, that's all I had on that. Next item would be going into closed session. So the closed session, the open meeting law, Minnesota statute section 13D.05 subdivision 3C allows the Board of Commissioners to close a meeting for the following purpose, among others, to develop or consider offers or counteroffers for the purchase or sale of real property. While in closed session, the board will be considering the development of an offer to purchase the real property identified as parcel ID numbers 82.4374.0170 and 82.440115.0120. I will hereby enter a motion to close this meeting for this purpose. And with no further business, we will adjourn the meeting today. Thanks, everyone.